drugs healing from a self-inflicted gunshot wound to the chest. That's how one woman is walking around Chattanooga tonight. Good evening, I'm Latricia Thomas.
And I'm Calvin Sneed. But could a new behavioral health facility help people like that, and with what funds? Hannah Lawrence takes a deeper look into Erlanger's new plan. Hannah.
Calvin and Latricia, the original release from the hospital about the project said that the Council for Drug Abuse and Alcohol Services and Park Ridge opposed the new facility because they already had enough beds. Today, the hospital said that the new program will offer a more intense level of short-term care than what exists in other area hospitals, and it will be funded differently.
And most of the girls that I rescue are high on crack cocaine.
Katrina Cabe has devoted her life to rescuing prostitutes working the streets of Chattanooga, a life she once lived herself.
They have no kind of insurance, no kind of assistance at all because they're on drugs. They don't have time to adhere to any kind of program.
Erlanger says its new facility approved this week will help even the people who have nothing.
The needs in the community and the region are so overwhelming.
Senior Vice President of the hospital, Joseph Winnick, says the problem right now is that people are filling Erlanger's emergency room with more complex problems than doctors here are equipped to handle.
So many people have coexisting conditions. You have a medical problem and a behavioral health problem, and they were not getting that care.
That recently happened to a girl Cabe has been trying to help.
A couple of weeks ago, I got a phone call that one of my girls had been shot.
When Cabe saw the woman last weekend, she told her she was trying to commit suicide, but the kick from the gun prevented the attempt.
She had an entrance wound here and an exit wound here. She is out walking the streets right now selling her body with a bullet wound through her chest.
Cabe says her friend was in the hospital for a few days, treated for the wound, but didn't receive any mental help. Winnick says it's those kinds of issues doctors at the new facility will be able to address.
Whether it was a young kid that may have committed suicide or tried to, or a pregnant mom or with an addiction.
We have people overdosing. We have women shooting themselves in the streets. We need beds for them now.
Erlanger says that we'll have more than 20 beds to treat those adults with addictions. Calvin.
Thanks, Hannah. Funds for construction of the new hospital will come from a public company called Acadia. No funds from taxpayers, Erlanger, the city, or the county will be used to build the facility.